Welcome everyone to your teaching on the coronary circulation. In this short video we'll cover the anatomy of the blood supply of the heart and how the coronary blood flow is regulated and what affects the myocardial oxygen supply. So let's get started with the coronary circulation. So the heart is supplied by the right and the left coronary artery. These are the first branches of the ascending aorta. The right coronary artery arises from the anterior aortic sinus, and the left coronary artery arises from the posterior aortic sinus. The right artery then supplies the right atrium, the right ventricle, the sinoatrial node, and in about 80% of people also supplies the atrioventricular node. It also supplies about 1/3 of the interventricular septum. On the other hand, the left coronary artery supplies the left atrium, the left ventricle, 2/3 of the interventricular septum. Due to the supply of the right coronary artery to the sinoatrial atrioventricular node, a sign of ischemia or infarction that's affected by the right coronary artery can present as bradycardia or complete heart block. The right and the left coronary artery also has branches. So the left coronary artery divides into the left and anterior descending artery and also the circumflex artery. The right goes around to the back and also becomes the posterior descending artery. It also gives off a marginal branch. Venous drainage occurs by the several different cardiac veins. So there's a great which drains the anterior aspect of the heart. We have a middle cardiac vein which predominantly drains the posterior aspect of the heart. Then there are also small cardiac veins, as well as Sebastian veins which drain directly into the left atrium. These form part of the shunt. All the veins then drain into the coronary sinus, which drain into the right atrium. This is all the veins except the Sebastian veins. Now we move on to talking about how coronary circulation is regulated. So coronary circulation takes part in what we call autoregulation. Autoregulation is the ability of an organ to maintain constant blood flow despite changes in blood pressure. For the coronary circulation, this occurs via different mechanisms. For the coronary circulation, this occurs by a combination of metabolic factor, myogenic factors, endothelial, autonomic, and hormonal factors. The metabolic theory is that during increased myocardial activity, there will be an increase in the release of certain chemicals or tissue mediators such as hydrogen ions, potassium, adenosine, carbon dioxide. This leads to vasodilatation of the coronary vessels, therefore increasing blood flow to the area. This is something that's also seen in other organs and also other organs that also have autoregulation. So second, we talk about myogenic theory, which describes that when there's a pressure change in an artery or an arteriole, so if there's an increase in blood pressure, there'll be an increase in the stretch of the smooth muscle of the vessel, causing a constriction of the smooth muscle. This then causes a reduction in the blood flow and therefore reduction in the blood pressure. And the same occurs the other way around, where if there's reduction in blood pressure of the vessels, it causes vasodilatation, so relaxation of the smooth muscle, so more blood flow can occur. Next, we talk about the endothelial theory. So vascular endothelium produces different vasoactive substances. They produce nitric oxide, prostacyclin, thromboxane. Thromboxane causes vasoconstriction. However, nitric oxide and prostacyclin causes vasodilatation. The autonomic system also has a effect on the coronary circulation. Alpha adrenal receptor stimulation causes vasoconstriction, specifically alpha-1 receptors. Beta receptor stimulation causes vasodilatation of the coronary vessels and also increases heart rate and contractility, which causes an increase in oxygen demand. When talking about the hormonal contribution, we think about hormones such as angiotensin II, aldosterone, adrenergic peptides, ANP. So ANP causes vasodilatation, angiotensin II causes vasoconstriction. If you're ever asked about factors affecting myocardial oxygen supply, it may help to think about it as a pipe system. So pipe is carrying the water, so water can be the oxygen, and the pipe is your coronary vessels. If there is less water is able to be supplied to the tap. So if there's less oxygen in the blood, less oxygen will reach the heart tissue. The coronary perfusion pressure is also important. So this is the pressure that will be supplying the system to the pipes. Coronary blood flow predominantly occurs during diastole. The perfusion time is important. As heart rate increases, the time in diastole reduces, therefore perfusion time also reduces. The patency of the coronary vessel, if there's evidence of thromboembolism plaques, would reduce the diameter of the coronary vessels, which means that less blood can flow through. Other factors also affect the coronary vessel diameter, so such as nitric oxide. Using GTN, for example, will cause vasodilatation. The blood viscosity is also another factor, so increase in viscosity, therefore increasing the thickness of the blood, also cause a decrease in flow. Some of the factors affecting myocardial oxygen supply can be looked at using the Hagen-Poiseuille equation. Another factor which we mentioned earlier on is the actual amount of oxygen, so the amount of oxygen in the blood, so which can be calculated using the oxygen content equation. In this, factors such as anemia, low saturation would cause reduction in the oxygen content, therefore less oxygen is able to reach the tissues. Thank you very much for listening. I hope you found that useful, and I'll see you for the next one.